Okay, I'm scanning the room. Hi, Mr. Miller.
Yes.
Hi, my name is Courtney. I'm going to be your nurse today. Today we're going to perform an abdominal assessment. Is that okay?
Yes.
Okay. So I am checking the chart. I am providing privacy. I am washing my hands. Can I see your wristband, please? Can you tell me your full name and date of birth?
Zachary Miller, 7/26/93.
Okay, perfect. Are you currently on any medications?
Yes.
And what are you taking?
Prolaria, Advair, and Singular.
Okay, and what do you take those for?
Asthma.
Okay, do you have any other medical conditions?
No.
Are you allergic to any medications?
No.
Okay, any major surgeries?
No.
Okay, so before we start, I'm going to ask you a series of questions in regards to your diet, self-care behaviors, bowel habits, urinary habits, and then reproductive organs. Is that okay?
Sounds good.
Okay, so to start with your diet, are you on any special type of diet?
No.
Okay, do you have any issues with indigestion, nausea, vomiting?
No.
Any abdominal pain during, after eating?
No.
Any concerns with your diet?
No.
Okay. Next, we'll go on to bowel. When was your last bowel movement?
Yesterday.
Okay. Any issues with that?
No.
Any issues with consistency?
No.
Okay. Do you have any pain while with bowel movements?
No.
Any blood, stool?
No.
Any hemorrhoids?
No.
Okay. Any issues with urinating?
No.
Any trouble starting a stream?
No.
You have any pain with urinating?
No.
Any discharge?
No.
Okay. Any incontinence?
No.
Okay. Any urgency, frequency?
No.
Okay. Do you perform a testicular exam?
Yes.
How often?
Once a month.
Any abnormalities with that?
No.
Okay. Are you sexually active?
Yes.
Okay. Any issues or concerns with reproductive organs?
No.
Okay. All right, so we are going to start with the actual assessment. So have you lay down for me, please? And move the camera. All right. First, I'm going to start with inspection. So I'm just going to feel lightly for temperature, moisture. Okay, on initial inspection, there is no pulsations, there is no distended veins. Temperature was warm throughout. There was no moisture. Skin is appropriate for ethnicity. Was there any pain?
No.
Okay. Hair is distributed evenly throughout. All right, so I'm going to start with listening with the diaphragm. And the umbilicus is midline. Contour is flat. All right, we'll listen starting in the right lower quadrant. And we're in the left upper. And left lower. Okay, bowel sounds were hyperactive throughout. And next I'm going to percuss in each quadrant. Okay, tympany was heard throughout during percussion. And next I'm going to start with light palpation. And just let me know if you feel any pain or tenderness, okay?
Okay.
No pain?
No.
Okay, we're going to do deep percussion, or palpation, excuse me. Okay. There was no masses, no bulging felt throughout, no pain.
Nope.
Okay, we're going to listen for bruise. I'm going to listen with the bell of my stethoscope. And we're going to start with the renal. I'm going to do the left renal. And right. And then the aortic. Okay. And then the iliac. Okay, there was no bruise noted. And at this point we could check the femoral pulse, which would be right within the groin on both sides. Okay, I'll have you sit up. Okay, so earlier you discussed, or you told me that you take medications for your asthma. Do you feel as if you know how to take your medications?
For the most part.
Okay, so when do you use your ProAir? Do you use it before an attack, during, or after?
During.
Okay. How often would you say you're using that?
That's needed.
Okay. On a daily basis, how many times do you think you use it?
Maybe once.
Okay. How often do you use the Singular and the Advair?
My Singular I take every morning, and the Advair I do 1 puff twice a day.
Okay. And do you know when you would use those?
Before.
Okay. Do you know what your triggers are when it comes to your asthma?
Pollen and dust.
Okay. Do you usually try to avoid them? Do you know what to do if you come in contact with them?
As much as possible.
Okay. Do you know any other ways to help with asthma attacks aside from using your ProAir?
No.
Okay. So when it comes to your medications, the Singular and the Advair are good to help prevent asthma attacks because they help reduce inflammation of the lungs. The Advair is a bronchodilator versus the Singular, which helps reduce inflammation of the lungs in a pill form. It's not a bronchodilator. Whereas the ProAir albuterol helps open up the lungs during an attack. Have you ever used pursed lip breathing?
No.
So you would purse your lips and you're going to breathe slowly in and out, and that helps control the breathing during an asthma attack. Have you ever heard of an asthma action plan?
No.
Okay, so with an asthma action plan, first you write out your medications, you kind of identify when to take them, it shows if you're familiar with how to use them, the purposes for using them, and then next you identify your triggers. It's really good to know your triggers when you have asthma because you can avoid them, or at least try to, and then you can kind of clump it all together and figure out what to do when you come in contact with a trigger, what medications to use, if you're using them correctly, basically get the best control over your asthma. Do you feel as if your asthma is controlled?
For the most part.
Okay, good. Well, do you have any questions for me in regards to your asthma?
Nope.
All right, well, here's your call light. The bed is in the lowest position. Here are your belongings, and you're all set.